Ayurveda is what made my sister realize it was her diet that was so severely affecting her skin health, but so many others don't realize the impact of their diet on their skin or the benefits that Ayurveda can have for them when Western medicine has stopped helping. So now that I'm older, I know there's something else I can do other than tell my sister to stop scratching, and that's to educate myself and others. This summer, I've been interning with an Ayurvedic doctor, Dr. Anju Sunny, to learn more about how Ayurveda diagnoses and treats eczema patients. I've also worked with another one of our panelists, Dr. Chorgade, a college professor and expert in drug development and reverse pharmacology, to write a review paper comparing Western and Ayurvedic drugs and treatments. I've been working on making DIY kits with different Indian ingredients like neem and turmeric to distribute in my local community to spread awareness about the benefits of medical systems they may not be familiar with. And I'm grateful for the opportunity to share more about Ayurveda and skin health with you today. So, the purpose of this panel discussion is to explore multiple viewpoints and learn from other people. It's a safe, respectful, and educational space. And so, without further ado, I'm excited to announce our panelists and let them tell you a little bit about themselves, starting with Dr. Chorgade.
Thank you very much indeed for, first of all, giving me a chance to be on this panel. It is something that is very encouraging and stimulating. As was told earlier, I am a professor of organic chemistry. All my degrees and academic training has been in organic chemistry. Over the years, I've had enormous industrial experience in Western pharma companies like Abbott, Merrell Dow, Cytomed, and Genzyme. And I got interested in this whole concept of Ayurveda after a very profound meeting with Dr. Ashok Vaidya, who is a true genius from India. We have been working, and now I have the great pleasure of having another panelist here, Uday Ohre, join me in this quest of using the knowledge gained from Ayurveda into discovering new and improved drugs for a variety of therapeutic indications. Thank you.
Thank you so much, Dr. Chorgade. Mrs. Agarwal, would you like to go next?
Yeah, sure, I can go next. So, my name's Anu, last name's Agrawal, and I am the mother of two, like I'm a proud parent of two beautiful girls. One of them is Vedika over here, who is our moderator. And my older one, Nikki, she's the one who, had eczema, and she kind of is still kind of, living through it, and experiencing it. So, happy to be here, and share my experience. Thank you so much for hosting and inviting, Vedika.
Thank you. Our next panelist is Dr. Uday Ohale.
Hello. Hi, everybody. I'm Uday Ohre. Uh, I come from a pharma background, and I have more than 38 years of experience in pharmaceutical sales, marketing, operation, and training. Presently, I'm working as a setup and incubation consultant for Greenpeace Field Pharma projects. I am also involved in a research and skill development society, which is formed in association with Dr. Chorgade, called Think Research and Skill Development Society, where the objective which was stated by Dr. Chorgade is what we pursue, that using the Indian knowledge and you making newer molecules using all the modern techniques and modern sciences. And I am also involved in a company called Ayurveda, where we are selling innovative healthcare products. Okay, each product selected for in Ayurveda is either a new research or an innovative product from the traditional knowledge primarily. And of course, Vedika, thank you very much for giving me a chance to be on a panel.
Of course, thank you, Dr. Ohale, for being here. Finally, I'd like to announce Dr. Twinkle Yadav.
Good evening, everyone. I'm Dr. Twinkle Yadav. I'm a dermatologist based in Delhi, and I focus on both the clinical as well as the cosmetic parts of dermatology, and I specialize in pediatric, that is the child dermatology. So I've seen many people struggle with eczema, not just physically, but emotionally. So I'm very excited for this discussion because healing eczema often requires more than just medicine. It needs cultural understanding, dietary awareness, as well as shared experiences. So thank you, Vedika, for bringing us together.
Thank you for the introductions, everyone. To begin our discussion, we're going to go in the same order as the introductions we just did, or maybe we'll switch it up a little bit. So this first discussion round will be setting the stage about Ayurveda and eczema. So to Dr. Twinkle, my first question is, what is your clinical explanation of eczema, and what are the most common misconceptions that patients have when they first see you?
Okay. So according to the standard textbook definition, eczema, also known as atopic dermatitis, is a chronic inflammatory skin condition, results from a combination of genetic, environmental, as well as immune-related factors. The skin barrier here is weakened, leading to increased moisture loss from the skin with a greater sensitivity to irritants as well as allergens. Clinically, the patient generally comes to me saying that, doctor, I have intense itching. I cannot sleep at night. The skin is very dry. They have dry, itchy, red, and inflamed skin. It often affects the flexures, that is the folds, majorly the armpits, the elbows, the neck region, but it can appear anywhere depending upon the severity also. It's commonly associated with other conditions that can be systemic, such as asthma or allergic rhinitis, with management focusing on restoring the skin barrier, controlling inflammation, identifying and avoiding the triggers, and most importantly, since it's a chronic condition, then a patient education for long-term control is very essential. So the common misconceptions that the patients come up to me is with that eczema is contagious. See, if I have eczema, my sister or a brother will also have eczema. This is not true. Eczema is not infectious and it cannot spread from one person to another. But mind you, it is a genetic condition. So it is likely possible that if I have eczema, my brother or sister might suffer from eczema, not with the same severity, might be less severe or more severe, or might be in some other form like I discussed. If one has a skin condition, the other can have a skin condition or can have other conditions such as asthma or an allergic rhinitis which is associated. Then the second misconception is that, doctor, give me one cream which will cure it all. This is not at all possible. Since it's a chronic condition, it is not something that will resolve overnight. We will have to counsel the patient that it might take some time, and it is a holistic approach that will need to be adopted for the complete cure or control of the disease. The third misconception that the patients come up is with the doctor, you have prescribed me steroids. Is it not harmful? Will it not damage my skin? See, the first line management of eczema is surely steroids only in acute flare-ups, but it is the dermatologist or the doctor who knows for what potency of steroid has to be given, for how long the steroid has to be given, and how much the steroid should be applied. And depending upon the age of the patient, we devise treatment plans for the patient. And other misconceptions could be it's just an allergy. Like I said, it is multifactorial, it can involve genetics, immunity, and skin barrier dysfunction. Some patients feel that it'll get completely cured, and they'll grow out of it completely and eventually. It is true in some cases, but in my experience, the recurrences and persistent symptoms are very common, and they may persist even into adulthood. Maybe a less severe form, but but there will be a part of the disease which will still be there. And sixth misconception, which is not a misconception exactly, is natural or home remedies that are safer as compared to proper medications. It is not always true. Some studies have shown that they are effective, but you may never know that one product which may be beneficial for one patient may not work and may even act as an irritant for the other person. So yes. Thank you.
Thank you so much, Dr. Twinkle. Our next question is to Dr. Chorgade. How does reverse pharmacology help validate ancient remedies for modern treatment? And can you share a case where a traditional formula inspired modern drug discovery?
Yes, absolutely. Thank you. And Dr. Twinkle has set the stage for a lot of what I'm going to say, and she has done it very expertly and in a brilliant fashion. So, as I told you, I have been a drug discovery chemist, mainly in the Western pharma mold. What that is it relates to allopathic medicine. And one of the very important aspects of allopathic medicine is you study the chemical structure, you make some molecules, then you go about studying the molecular biology, the mechanism of action. The dominant thing is it is one drug, one target, and then you subject it through a series of animal experimentation and all that. You then do the phase 1, phase 2, phase 3 clinical trials and finally get approval for a drug. The legendary chemist and scientist who was also a pharmacologist was Dr. Ashok Vaidya, and he formulated this whole concept of reverse pharmacology or observational therapeutics. What exactly was the basis of that one? He rationed and reasoned very profoundly, I will say, that we in India have been the beneficiary of the wisdom of the rishis, as he would call it. We have been using plant sources and many other things in healing our people, getting sick people to be much better. And what that really transpired was that why don't we use this traditional knowledge and discover new drugs through new chemical entities and all that. Now, what is the dominant feature of reverse pharmacology? It is simply that many of these medications have been already in humans for centuries, and there are no there are very few to no side effects. I mean, nobody has died from eating a pomegranate too many. Nobody has died from eating a guava too many. And all of you are aware that if you take Karela in your normal diet, it of course has a controlling effect on blood sugar. Now you say, oh, well, all the rishis knew all this stuff. So what do we bring? One of the dominant things in Ayurvedic medicine, Indian traditional medicine, is very simply the fact that this was discovered years ago. The most important factor is it is one drug, multi targets. So that is why you will not see the allopathic concept of one drug, one target. The same fruit, plant extract, or whatever has a potential and power to transmit across many biological receptors. And now, what is the negative? Because in those days, people didn't have access to the modern chemistry, to the modern molecular biology, and therefore words like mechanism of action were never known. Me and my colleagues, particularly Uday Hole and all, we are out to discover drugs using this concept. This is also called as observational therapeutics. The pioneer has been Ashok Vaidya, of course, who is as close to genius, unfortunately passed away last year. What you asked me to give you some examples, and I will allow me to give you rapidly two or three. First one came from China, from a brilliant scientist called Dr. Yu Tu. What she set out to do was to conquer malaria. And she analyzed documents dating back from the Han Dynasty, about 200 before the Common Era. Now, what did she require to do? She went back to all those soil samples and did some research. She isolated in a very painstaking way and studied this. That molecule is now known to us as artemisinin, which became for a long time the best selling anti-malarial drug. In India, we have had absolutely superb examples from Rauwolfia serpentina, the plant. We have got reserpine, and you all know the uses that has been put into. I'll give you two examples which are not so well publicized. Every person in every village in India, whether you are in the north or south, they know that to avoid the effects of the hot sun, if you are suffering from sunstroke, or nosebleeds, people carry a raw onion inside their coat pocket or whatever. When they are feeling dizzy, they automatically cut the onion and sniff it, inhale it. Now, did the Rishis know that could be something very useful? Yes, they did. Did they know the chemistry? No. Now, Professor Eric Bloch in SUNY Albany has extracted the components, and believe it or not, he markets them in the USA as anti nosebleed remedy and anti sunstroke remedy. An even more profound example, my grandmother, my mother, all these very distinguished women, they used to always give me on my breakfast yogurt, on the shrikhand and all, which we Marathis particularly like. They always plant pomegranate seeds. Why is that? Later research has shown that they contain some gramitidine alkaloids, which are great for reducing diarrhea and dysentery. Now remember, in India, all the diseases were waterborne, and now this came about. So literally people are using gramitidine alkaloids in pharmaceutical products and like Imodium and all that. Now 12 years ago, Harvard published a paper. If you drink 2 glasses of pomegranate juice per day, it will regress prostate cancer. Regress, mind you, that's the operative word. And it will have a beneficial effect on breast cancer. So this is a science that is old and that is going to be profoundly impactful as we are going forward. It will be a great conduit for all the new chemical entities and all that. And I must really admire the Ayurvedic physicians who are involved in this remarkable effort. Remember, they are treating you, and scholars like Dr. Twinkle, they are treating you in a very holistic sense. So you will always find 3, 4 drugs that are prescribed. Unlike in the allopathic world, where somebody will give you a prescription for a steroid and don't worry about anything else. I think that's a perfect segue for my distinguished colleague Uday Ohre to say his bit.
Of course,
Thank
Mr.
you.
Ohale, would you like to go?
Yeah, I would like to add here something. I first start with what Dr. Twinkle has spoken about. She spoke about the home remedies also can give certain kind of side effects, and it is very important for us to know that this happens. And always Ayurveda is taken as in Hindi, if I say har marj ki ek dawa, any plant you take it, it will say it works from the head to toe in every disease condition. However, it is extremely important that we need to really work out the science behind it, find out exactly which works in which condition, and these can avoid lot of issues of side effects or unwanted effect of these drugs. And this is something modern chemistry, modern pharmacology can add to the Ayurvedic knowledge. Okay. Now, when we come to the next session, I will discuss more about the marketing and how it helps in formulating the discovery strategies.
Thank you so much. Our next question is for Mrs. Agrawal. What has your child's eczema journey looked like from diagnosis to finding triggers?
Thanks for the question, Vedika. So my older one, as I was mentioning briefly, during my introduction, she's had eczema since birth, and she's had it for like all her life now. She's 21, and it's been a long and a difficult journey. Words like eczema or food allergies or hives, allergic reaction, seborrheic dermatitis, etc. These were not even part of my vocabulary 20 years ago. I had no idea what allergies even mean. And they, I had to pick them up. They did become a part of my vocabulary. I was a parent who had no clue and I was forced to learn. So the first couple allergies that we figured out, were trial and error. So Nikki was eating this Indian dish called curry, right? And it's made out of chickpeas and yogurt. And her entire face kind of broke out with these, red dots, etc. So I called the nurse line, and the nurse described to her, what's going on, and the nurse was like, "Oh, she's got hives. She's having an allergic reaction." And I'm like, "What are hives, and what is this allergic reaction?" So she kind of walked me through it, told me what to do, give her this medicine, that, etc. And then, it was fine. But that time I kind of realized, several of the incidents that had happened leading up to that point, all of which were allergic reactions, but we just always thought, oh, she's a baby and she has sensitive skin and whatnot. And this is like, this is why it's happening. So from there on, as she started eating solid foods and, more and more food exposure, we started figuring out, oh, okay, she might be allergic to this, she might be allergic to that. And then I got a blood test, full blood panel done for her. But then that's not, very accurate. It wasn't accurate 20 years ago, and it's not accurate even today. So there are a lot of false positives and whatnot. And if I had followed that blood work at that point in time, he would probably not be eating anything today. Uh, and so, well, I couldn't have fed her anything at that point in time. So my allergist at that point in time said, like, feed her if she's not reacting to it, and then we go. And now that's kind of like what most allergists will say. If there is no obvious reaction, then you can continue feeding. And part of that reason is there has been this explosion of eczema patients and food allergies and whatnot, and medical science was still trying to figure out the connection between the two, etc. So for the first 2 3 years of her life that continued, but then it took a backseat. It just disappeared. Her skin was completely under control, no red patches or anything like that. There were occasional flare-ups, but nothing major. And we were primarily treating her at that point in time with, the steroid creams that Dr. Twinkle was mentioning. I had an over-the-counter. I started with over-the-counter, 0.5% hydrocortisone, and then went to 1%. But then, as she reached high school, this came back. This came back, almost like with a vengeance, and it was all over her body. Like, I wouldn't say all over, but her itching increased, and she would always have this redness around her mouth. And we were trying out different medications, but they were not really working. And at that point in time, we figured, okay, let's try this Ayurvedic thing. There seems to be a cure for it. All of my research said go for panchakarma and go for, Ayurvedic treatments, and it heals from inside. So we figured, let's just give it a try. We've given, um, Western medicine a try for several years. Let's try this out. And so that's when we ended up going to Kerala, staying at this Ayurvedic hospital, which was almost like a wellness center, but they basically treat patients of all kinds over there. And we stayed there for almost 2.5 weeks. While she was going through the treatment over there, part of the treatment is kind of first removing all food triggers, and then flushing her body, from toxins, and then kind of starting to give her these Ayurvedic medicines to heal her gut and repair the gut lining and the gut skin barrier, and the Ayurvedic massages and stuff like that, to with all these kinds of medicines. Her skin started to improve, and I started seeing all of those improvements. And during this course and after this, what we started finding out as we restarted introducing all the foods, she was allergic to dairy. Now, when I say allergic, not in the medical sense, she wouldn't get an allergic reaction, but it was an eczema trigger. And that's kind of what launched me on this figuring out thing, that okay, she is reacting to dairy, she's reacting to almonds, she's reacting to peanuts, and these are things she had been eating her entire life. Not a medical allergic reaction, but these were all eczema triggers. And so, with all the other things that were part of her forbidden foods, we had to kind of add these foods to her, list of things that she cannot eat and she shouldn't be eating. And if she eats it accidentally right now, again, it's not like an allergic reaction, but it will kind of, there will be an eczema patch somewhere on her body, and her itching will increase and stuff like that. So we're still working through all of it. And yeah, I mean, I don't know if there will be a time when she can, start eating all of those foods that are her triggers. But yeah, we are hopeful. So yeah, thanks.
Thank you so much for sharing your journey. So our next round covers food, environment, and treatment overlap across different medical systems. And if anyone has any questions that come up while our panelists are speaking, please feel free to put them in the Q&A and we will reach them at the end. So our first question is for Dr. Twinkle. Can certain foods truly worsen eczema symptoms in your patients, and how do you determine triggers?
As Miss Anu Agrawal has mentioned her journey with her daughter, so eczema can certainly be triggered by some food items. So in some patients, especially children, certain foods act as trigger. That can act as a trigger, mind you, the word trigger, or can worsen the eczema symptoms. But not everyone with eczema has food related triggers. So first of all, I would like to mention that a food item that was not a trigger earlier, that the child has been eating the food, the child never reacted to that food item before, but now suddenly the reaction occurs. That can happen. A previous trigger can now also stop triggering the immune system. So that is another option. So so how we as doctors identify the food triggers? First of all, we ask the patient. Generally, the child is very small, so we ask the parent about the case history. The patient or the parent generally tells that that I first look for any patterns that there are any flare-ups that happen after eating any specific food. Most of the cases, it is generally seafood or peanuts or dairy that generally occurs. We ask the patients to prepare a food diary. The patients are asked to track what they eat and any skin reactions that follow. And then we and then we take the approach of an elimination diet where one food is removed at a time, like dairy or eggs, and then we observe the skin of the patient for 2 to 3 weeks. Mind you, we never eliminate multiple food groups at once, especially in children. It is just one by one that we remove the trigger that is most likely to cause in most patients, and then we look at the skin condition. Also, in some cases, we can also do allergy testing if needed, in which we do skin prick test or blood test that can help. But they are open to interpretation. Like most of the food items in the panel that we call nowadays in the panel will come positive, but it is only by hit and trial method, by elimination diet, that we can figure out what the child is exactly allergic to. So the food can play an important role in eczema, but the triggers may vary. So every patient should be given a slow and a personalized and supervised approach by the medical professional, and not just trial and error alone. Thank you.
Thank you, Dr. Twinkle. So our next question is for Mr. Ohale. You lead a pharma innovation company. How do market dynamics shape which skin treatments become available and trusted, especially traditional versus modern?
Okay. Now, coming to market dynamics have played a very important role when it comes to innovations and marketing of pharmaceutical products, whether it is cosmetics, cosmeceuticals, or other pharmaceutical products. Now, when we are talking about in relation to eczema, let us now discuss about it. What has been found that most often it is the doctors who initiate the requirement. And if the connect is there with the doctors, because patients, at least when I talk about in a broad sense, I talk about India, the patients first reach to the doctors, and these doctors they have different issues which they talk to the these medical professionals. They discuss during their conferences, and then the discussions which happen between pharmaceutical companies and the medical practitioners. And this is how the formulation are thought of. Okay, and the research is directed. Whatever there are two type of researches which we have experienced. One which is happening in the Western world, where they go from a small molecule and try to create a molecule which will lead to the a drug. Whereas in India, it has always used the product or the natural product are surrounding us. And so the various people have used very different natural products. However, what has been observed is that these natural products may not give consistent results. So there are various reasons behind it. And this is where it is very important to understand the market needs and how to understand the modern sciences also. Here I feel what is important is using these modern sciences. If we understand the mode of action and individual bioactives which are present in the various plants which are used as a therapy, we can work out on standardizing which bioactives are extremely important and what is the proportion of these bioactives. Because you, all of you might have heard that a plant or a plant part is picked on a particular day of the month. It may be the full moon day, it may be no moon day, or some they are picked up only during monsoon. And why? Because there are certain bioactives which are prominently present during these days, which have a clinical activity. Now, in this case, we what we are doing presently is we are studying these very potent clinical results, and these potent clinical results and the assays or bioactives is what we are studying. And these proportion of bioactives we are trying to standardize in each capsule or each tablet or the creams what we are devising. Thereby, what happens, we can get a consistently same quality of product, even if it is plant-based product. I wouldn't call it 100% Ayurvedic because we may be diverting away from a classical Ayurveda method. However, this method is found to be more effective, and this method can actually bring a lot of newer therapy in the market, which will help various patients in the skin condition and of course in other disease conditions also. And this is what exactly we are doing. My association with Dr. Chorgade has been extremely important in this particular area of innovation, and we are trying all this, using pharmacology, using biochemistry, using molecular biology, modern chemistry, all this into Ayurveda and getting Ayurveda shift into a modern drug. Okay, government also is helping us in a big way. Now, government also has officially authorized. Government also has officially authorized the pharmaceutical companies to call it as a prescription drug if it is standardized in this fashion. And these particular I would say this particular force, which was put to the government end, was done by Dr. Ashok Vaidya. And we are grateful to him because he has opened a completely new avenue for pharmaceutical product research. Okay, and it has been found. Now we are working on some products for, I wouldn't call it for eczema, but for itching. We are working on a product for itching, and this has come from a market demand. We currently need a product for itching in a moisturizing base. Dr. Twinkle will agree there are a lot of moisturizers which are used in a condition of eczema, and newer moisturizers with a better control of itching would be an ideal way of starting the therapy, right? So it has always been observed that market plays a very important role. The requirement plays an important role. And what has happened is modern science and a marrying of modern science with Ayurveda or the traditional knowledge which we carry can actually open up a very big new vista for healthcare of various treatments.
Thank you so much. So, Dr. Chorgade, many patients toggle between steroid creams and Ayurvedic pastes. Do you recommend a hybrid approach, and where do you see convergence?
I would, in principle, recommend a hybrid approach, keeping in mind that Ayurveda is a more long term holistic thing. Almost all the allopathic drugs are designed for instant relief and feeling better. In the old days, the doctors would say, take two aspirins and call me in the morning. Similarly, these steroids, when you are experiencing intense itch, then you apply it to the affected area. But you cannot live on that for months and years. That's not going to be very effective because you may overdose on things. So the idea of a hybrid approach is perfect. So when there is an immediate need, immediate discomfort, of course, you take the steroids and all that. But now tie it in with all the Ayurvedic treatments which are geared for the longer term. And this is an extremely important object lesson for many people to convey. I have seen, believe it or not, people who go to their neighborhood pharmacy and pick up these steroidal creams and all that, and they apply it far too liberally than is normally required, and the effect there is not going to be longer lasting unless you couple it with, as Dr. Twinkle and others have alluded to, modifications in your diet, even your lifestyle, and everything else.
All right, great answer. Thank you. Our last question in this round is for Mrs. Agarwal. How did changing your child's diet affect their skin, and how long did these changes take?
Um, yeah, I quickly wanted to add to, something to what Dr. Chorgare was saying, about long-term use of these before I answer the questions. So one of the things that I've found, and not in our case necessarily, but talking to like I'm on some of these parent forums and whatnot, where they have kids with eczema and etc. And there's something called TSW, right? Topical steroid withdrawal syndrome. And that's sort of like a real thing that many people experience. So when people are applying these steroid creams super liberally and generously on their skin, the side effects are real. It makes your skin thinner and whatnot. And oftentimes, either the people themselves, the patients themselves don't know what it is, or, the doctor did not do a very good job of explaining to them. But regardless, these things happen. And so the long-term use, it's really like, what Dr. Chorgare was saying, it's designed for short-term use, but really long-term, you have to heal your body from within. So kind of to answer in your, your question, basically, in our case, there were quite a few food triggers. So when we figured out, okay, she's reacting to dairy, and it's an eczema trigger for her, or like peanuts and almonds. Once we cut those out, the itching started going down. So the itch comes from within the body, and at the same time, we were giving her these Ayurvedic medicines, which were meant to kind of strengthen her liver and gut and whatnot. Probiotics, prebiotics, etc. All of those kind of things we were kind of strengthening and supporting her diet with these things. The itching started to come down. Her eczema, flare ups started to reduce. The inflammation that we could actually see in her skin started to go down. Now, we never cut out gluten, corn, etc. But what I've heard, from the experiences of many, many other parents, is gluten and corn and eggs. Those are massive triggers as well. And cutting those out initially, when you're trying to figure out, okay, what is the food trigger that's triggering my eczema? What is the food that's triggering my eczema? That kind of helps too. Like eliminate these things and then slowly start introducing, and you'll catch it right then and there. Yeah, thanks.
Thank you so much. So in our third round, each panelist will be giving one actionable piece of advice for families dealing with eczema. So Dr. Twinkle, would you like to go first?
Yeah, so my one key tip for families to manage eczema is keep your child's skin moisturized. That is within 3 minutes of bathing. That's called the soak and seal method. So use lukewarm water for the bath for the child, and while the skin is still damp, apply the moisturizer then and then. That is the emollient that we call it, then and there on the skin. Keep the bottle within the bathroom so that immediately after the bath it can be applied. And the emollient that should be applied should be fragrance free, pH balanced products, and avoid over cleansing the skin and use milder products. Thank you.
Thank you so much. Dr. Torgade, would you like to go next?
No, I think I've said my bit consistent with my knowledge. I'm a keen listener now. And I really got interested. And again, this is driving home to me the point that use allopathic medicine when you are facing a sort of emergency. And one of the famous statements of Ashok Vaidya used to be, if you are having a heart attack that is imminent, you are in imminent danger, of course, take all the cardiac stimulants and rush to the hospital. Then don't say that give me Ayurvedic treatments for a long term holistic care. I think what our society at all levels needs is a very balanced and pragmatic approach, which is being well highlighted in these discussions today. I one quick question for you, Dr. Twinkle. Did you just say that these treatments better have them fragrance free? Can you elaborate just a bit on that one for my curiosity?
Yes, sir. So when I say fragrance free, that means whenever a fragrance is added to any soap, a moisturizer, or any cream or an emollient that is to be used, it can act as irritant for many people, and especially people with a disrupted skin barrier. These can act as triggers that can further irritate the skin and contribute to the redness and the itching that is there in these patients. So we generally recommend the patients, even the pharma companies that make products for sensitive skin, that we call it in layman's term, we generally use these fragrance-free, what we call bland emollients that is given to these patients. Mainly,
Thank you so much thank you
yes,
so
sir.
much for that enlightening answer. I'll tell you why I asked that question. I've been doing a lot of reading on the Indian rose water. Whenever we go to weddings and all that, people sprinkle the rose water. And that, of course, contains the chemical compound beta phenylethyl alcohol. There's now an increasing body of evidence which shows that for people with sensitive skin, that can also increase the itching and all that. So people have to be extra careful. You just don't sprinkle rose water on anybody and everybody. Thank you for that answer.
Thank you so much for asking that question and elaborating on it. Mr. Ohale, do you have any advice you'd like to give everyone today?
Yes, as a marketer, I have a very special advice to everybody, and that is don't fall for marketing communication. Okay, you need to do research, you need to understand the ingredients, read about it, read about your condition, read about the ingredients before you finalize the product. And especially when you are using OTC product, then it becomes more important that you should be better studied rather than falling for those all glamorized promotions which are used in marketing.
Thank you so much. Mrs. Agarwal, do you
Thank
have
you,
any
thank
advice
you.
for everyone?
Yeah, I'll actually build on what Dr. Ohale was talking about, but as not just reading the labels and ingredients of the medications, but I think people should be reading the labels and ingredients of every single food item that they put in their body too. There is such an abundance of processed food right now in the market, right? Food is not like we don't cook our food from scratch. Even if you're making pasta, it's not like you're making the marinara sauce from fresh tomatoes. You're buying a jar and you're using that pasta sauce. So, what is in it? Look at the ingredients. If you don't recognize what's in it, look it up. Be aware of what you're putting in your body because a lot of these epidemics and a lot of these diseases that are coming about, especially skin. Skin, if you think about it, skin is your biggest detox organ, right? It's the largest organ in your body, and it's your biggest detox organ. And if it's reacting to something, it's telling you, okay, something is not right with what you're putting in your body. And food is the number one thing that we put in our body. So be aware of what you're eating. That would be, my number one advice. And, yeah, eat a variety of fruits, eat a variety of vegetables, um, fresh, go back to the basics if you can. Our agriculture has changed for good at this point in time. So there's not much we can do about it, but wherever you can, try to go back to the basics. Yeah.
Okay, thank you to all our panelists for some great advice. We can now move on to the audience Q&A session of this panel. And so I have a short survey that I will send into the chat for everyone to fill out. It's pretty short, and then we can now start our Q&A session, and we can take multiple perspectives for some of these. So I just sent the survey into the chat if everyone can take just a quick minute to fill it out. And then our first Q&A will be, are herbal remedies safe for children? And any one of our panelists can take this one.
In my opinion, as a professional chemist, yes, absolutely. Herbal remedies are indeed safe. I have myself used them a lot. And a perfect example of herbal remedies is one turmeric, which I was using for my parents were using it for my wound healing. And also, don't forget tulsi. All of us are conditioned to use tulsi
Mm.
extracts for variety of ailments, and the list is endless. And I have used them as kid and everything else. Remember when my mother used to apply paste of turmeric onto my wound? What do you think was the alternative? It was mercurochrome, which contains mercury and chromium, which nowadays we know is something that's not good for you.
Right, right, right.
Yes, to add to what Dr. Chorgade has just said, yes, they are very safe, and there are a lot of Ayurvedic medicines specially available for pediatric use in India, which are very safe and are being used by not only Ayurvedic practitioners but even by pediatricians also. And especially as you move away from big cities to the smaller town and rural areas, even the pediatricians are very regularly using many Ayurvedic medicines even in pediatrics.
As a parent, I have used herbal
Rather, I
remedies.
would say, as Dr. Twinkle, the biggest users of Ayurvedic products and modern medical experts are the dermatologists. In India, if you see.
I was just going to add, as a parent, I've used herbal remedies for both of my children, and we use it. But I did want to clarify, um, when I was using herbal remedies, I wasn't like, we need to be careful that we are not using these unbranded, things that, some practitioners put together. Go for the remedies where you know what is in it, what is the composition of that medicine. And that's kind of what we've done, like the haldi and all. Yes, those are excellent. I mean, like haldi or turmeric is anti-inflammatory. In fact, now a lot of the doctors over here have also started talking about it. It's called golden milk. You take haldi, you put it in milk, put a little bit of black pepper to kind of activate the curcumin in turmeric, and it's supposed to kind of be excellent for overall health, anti-inflammatory and whatnot. But yeah, I would caution against using anything that you don't know what it's made of. If that's something that someone's put in a paper and given you and you have no idea what that is, I would be very careful about it, because it's also very prevalent where people mix steroids and whatnot in herbal medicines, and then they try to sell it as an herbal medicine. So just be aware of what you're buying, just building on what we were talking earlier. Be aware of what you're putting in your body or on your
But,
body.
but that's a very fantastic comment, because yes, when we define herbal products or herbal medicine, obviously it goes without saying that they are from authentic sources and not
Exactly. Yeah.
adulterated by some very unscrupulous people. That is a brilliant comment. Thank you.
I'd like to add to this by saying that I had an experience, an experience where a patient who was initially had just patches of eczema, not generalized eczema, but after going to some practitioner, some local practitioner, they gave medication and claiming it to be herbal, and then after some time, maybe around 1 or 2 weeks after taking it and then withdrawing it, the child developed rashes all over the body, and the condition was so pathetic that the patient had to be given oral steroids and then other biologicals such as tofacitinib and all other drugs to control that flare up which was there. It's what we concluded from that case was that initially the child was being given steroids in the name of herbal medications to control, and then on it was certainly high dose because on withdrawal it had such a bad flare up that even higher doses of steroids and other biologicals had to be used in such cases, and these cases are very common in government hospitals, especially amongst children.
Wow. Yeah.
Thank you, everyone. So our next question is, what if steroid creams work, but long-term use worries me?
Okay, I think I'll answer that question. Steroid creams do work, and like I mentioned, these are the first line of medication that we recommend to our patients, from young children to old individuals, everyone. So they do work, but it is us doctors that tell them how much to use, and there are different categories of steroids. There is a WHO classification according to which the potency of the steroids are classified on the basis of their potency. So in children, we give mild potent, then moderately potent in adults, and then severely potent in other conditions, whereas in hands and legs. So these do work, but we, even as doctors, we do not recommend long term use of such steroids. So we always ask the mother or ask the patient to apply it in a certain manner, and then we, along with that, side by side, we also counsel the patient about the diet and the healthy lifestyle that we advise, and also the use of emollients, which because anyway in the long term we will have to taper those steroids and maintain the patient on more safer alternatives, which is bland emollients only.
Yes.
Thank you so much. Before we move on to our next question, I'd like to just ask everyone again real quickly to take the survey that is put in the chat. It's a really short one, just a couple questions. Okay, our next question is ghee good or bad for eczema?
I can try to answer it from my point of view. It's not necessarily good or bad. Like I have been using ghee even now, while my older one, she's allergic to dairy, but she's not allergic to ghee at all. Uh, the method of making ghee changes the composition uh, of dairy, and I don't know how and what. I don't know the science behind it, but ghee has been working for her. In fact, at one point in time last year, she was applying this medicated ghee to her, thick eczema patches, and it seemed to be kind of helping with that as well. Now it's a different thing. It, I think, blocks the pores and kind of started causing acne, so we had to stop that. But she did not have any major kind of side effects from that.
Okay, great. We have time for one last question. Can someone have food allergies and still follow Ayurvedic treatments? And any one of our panelists can take this one.
I think Uday could be well qualified to answer that.
Can you please repeat it once more?
Yeah. Can someone have food allergies and still follow Ayurvedic treatments?
Yes, if somebody has food allergies, they can very well take Ayurvedic treatment. For one reason, again, you need to find out here if any component from the Ayurvedic medicines are allergic, or causing allergy to the patient. If they are not causing allergies, then it is very comfortably the patient can be given Ayurvedic medicine. Or rather, if you see, you must have observed that Ayurveda never prescribes a single tablet. They will give you 6 different products together. The whole idea of Ayurveda always is that that if they give a particular product, they think the thought process is if there are possibility of allergies, there has to be something which will counter it. And then the third one. And so a complete approach is designed so that you will find that 6 or 7 products together are prescribed in Ayurveda, and you will never find a single molecule like a steroid or is given or an anti-inflammatory is given in Ayurveda. The day if you are given Google, then you are given something else also to ensure that you are not getting, acidity, hyperacidity because of Google. So they always add 3 or 4 products which ensure that these kind of allergies do not actually happen in Ayurveda. A good practitioner will always follow this method of treatment, which you might have observed when your sister was being treated by Ayurvedic medicines.
Yeah, actually, that's correct. It was basically, like 5, 6 medications that were given together, kind of to complete. And we were told exactly what is the purpose of each medication. Yeah, that's absolutely right.
Okay, well, that concludes our Q&A session. Thank you so much to all of our panelists and everyone in the audience for taking the time to join this panel today. And I hope everyone learned something new.
I certainly did,
Yes,
and I'm hoping that you will be a panel organizer for many different things in future. I think your career is launched now. You've done a
yes,
tremendous job, tremendous.
yes.
This
It
was,
is
yeah, this
indeed
was
a
definitely a great experience.
very informative session.
Very well managed.
Thank you all.
Thank you
Thank
so
you so
much.
much.
Thank you
Thank
for
you so
having
much,
us.
everyone.
Thank you, everyone.
Bye.
Thank you, everyone.
Thank you so much. Bye.
Bye-bye.
Bye.